sees us as salespeople, but we really have named the company as Integrity Health Advisors, as things that we kind of really value and how we position ourselves is that we work for you. So we always look for what's in your best interest. We are obviously doing health insurance and we kind of specialize in Medicare, if you will. So we go through all the certifications, licensing, and product knowledge so we can just kind of get you down the road of what you guys are looking for and what is in your best interest. So that's kind of where we come in and we partner with people like Brandon to be able to have that kind of relationship. So you know that we're not just somebody off the street, which maybe that's fine. But in this case, it's all about relationships and respect and stuff like that to be able to offer somebody that, we provide information to people with Brandon's skill set, and here it's vice versa because this is what we do for a living is advise you guys on Medicare. So I've been in the business since 2008, so there's a longevity of what I've seen in the marketplace, and things do change and products come and go. So we really understand the landscape of Medicare. So really want to provide that kind of knowledge base to you guys based on the foundation of when Medicare is going into place for you, or if you need to review your plan based on market circumstances of today's market. Because what we have available today wasn't the same, 15 years ago or whatnot. So Jenna and I work very closely together, whether you talk to me or Jenna, we'll always talk together to see if, we understand your needs and what product we would advise for you based on what it is you're looking for. And we help you enroll into the plan and we become your advisor. So that way, if you need our services in the future with claims or product reviews, all those kind of things, or if you need us to call into the carrier to help you, we being assigned as an agent of record will allow us to be able to do that. Okay, so that makes sense of where we come from? Head nods. Awesome. Okay, so there's some contact information here. And obviously, you can always go to our website at Integrity Health Advisors. You could just go there and click and book an appointment if you would like to do that. So try to make it easy for you. So just a full disclosure, this is Medicare's annual enrollment period where we're constantly on the phone talking to current clients and prospects, assisting them. So it's just a lot to do in a shorter period of time. So getting on our website and booking a meeting is probably the most efficient. I don't mean to be personable. It's just that way we don't play phone tag. So you just book an appointment and then we know we got you booked for 1 o'clock this afternoon and we'll be there. So appreciate that. Trying to use some of the technology to streamline efficiencies, right? All right. So as we mentioned earlier, we are independent advisors. We do not work for an insurance company. We do not work for a certain product. So we're not pushing Advantage, supplements, or Part Ds with any kind of personal reasons. What we do is we do a needs analysis. So if I see Amy's name on here. So if we talk to Amy and she goes, these are my providers, these are my wants and needs, and these are my medications, find me a plan that works with that. We go and we kind of do all the work, and then we present a proposal of here's what covers your plan, of your doctors and stuff like that. And then she ultimately would pick and choose what made sense, and we would talk through all of it. So that way, all that knowledge that's on Medicare.gov, we kind of condense that and present it in what makes sense for you at this particular time. So I always want to make sure that you guys know we work for you, not the other way around. And we don't work for any carrier. So we hold contracts with a lot of different carriers. I purposely don't hold contracts with every carrier because certain ones I don't, lack of a better word, I don't respect their product in the market for you guys and the service on the back end, because we always want to represent a product that we can stand behind. So that way, when you go to use your healthcare benefit, we know the claims are going to get paid. If we need to call the carrier, we can have some sort of relationship with a local manager of the company or somebody like that to help you guys with getting the care and the needs that you need. Okay, so that's kind of how we fit into the picture. As we said, we office here in Denver, but we are kind of got a national footprint. Here's kind of some of the stuff we're going to talk about today. What is Medicare? Some people may be coming new to Medicare. Some people could already be in Medicare. So hopefully we'll give you guys a golden nugget regardless of which scenario you're in. And we'll give you some knowledge that you'll take away as beneficial for spending 45 minutes, an hour with us here. Who is eligible for Medicare? What options are available to that individual? How do you enroll in Medicare and choose the correct option? What resources are available to you? These are all things that we're going to touch on today. So you'll be able to walk away today with answers to each one of these boxes.
Hey, Shane,
Yes, sir.
I've got some incoming calls. People are trying to log in. Do you have the ability to accept them as the host?
Let's see
I seem to
here.
have lost that ability when I changed you over to the host. Sorry for the technical. If not, no worries, but I just
Hold
thought I'd
on one
check.
second here.
Sarah, see?
Let's go choose this. There you go. I just admitted 9 more.
Boom. Okay.
What you talking about? Okay.
All right. Thanks. Sorry
All
about
right.
that. Thank you.
No, you're good. I'll kind of keep a watch on if there's new participants coming in, but thanks for letting me know.
Thank you.
All right. So for those that just joined, Brandon did say that he is recording this, and I presume he'll be sending that out to anybody that maybe missed the first couple of minutes. But really, it was an introduction of who Shane and Jenna are, and we are again partners with Prosperion, and we are an independent firm here in Denver that specializes in Medicare and knowledge and education to you guys. All right, let's go back into here. Okay. All right, who is eligible for Medicare? That's kind of the foundation. So if you're here for auto and home insurance, you're at the wrong Zoom call, but we're here talking about Medicare. So there's a lot of exceptions to every rule. So we're going to really kind of keep it high level. And when we say who is eligible for Medicare, we're typically looking at those individuals that are turning 65, right? So somebody who's a U.S. citizen has worked, submitted a gotten a paycheck and seen Medicare and taxes getting taken out. That means they've earned Medicare for when they turn 65, and wanting to use healthcare through the government. So that's who kind of is eligible for Medicare, paying into the system, being a U.S. citizen, and turning 65 is kind of our general age. But again, somebody could always fall an exception to that. They were here less than, maybe they've only been here 10 years. Maybe they didn't work the full 40 quarters. Maybe they're 55 and disabled. So there are definitely exceptions to the rule, but this is our kind of general who's eligible for Medicare. So enrolling in Medicare, why didn't I say AB? Okay, I had a typo there. That's fun. So enrolling in the alphabetical soup of Medicare. So we call this the initial enrollment window. So this is a very key window for those that are looking to get into the Medicare health insurance space. And it's typically right around their 65th birthday month. So if I was turning 65, my birthday is August. So again, if I'm turning 65 in August, I've got 3 months before, the month of, and 3 months after where I really need to make a decision. What do I want to do? Do I want to go into the Medicare space? Am I already automatically enrolled into the Medicare space? Do I have insurance through somewhere else? All these things need to be factored in when deciding what to do with Medicare. Doing nothing is not a smart decision, because that's when, if you ever talk to somebody that says, oh, you'll get penalized if you don't enroll into Medicare. There absolutely are penalties, and we want to avoid those by taking the proper action within these 7 months. So we need to enroll in Medicare A, B, D, or have some sort of group plan that excludes you from doing that. Okay? So something needs to be done during that timeline. Otherwise, there will be penalties. And unfortunately, once a penalty is assessed, it stays there for the lifetime of the member. Oh, all right.
Yeah, just go up to the.
Okay, we got Mike and Sally coming in. All right. All right, here's your alphabet soup of Medicare. You got A, B, D, C, and Medicare supplement. So we'll go into each one of these in detail. But you have your governmental programs, which is stands for hospitalization. B, which is a medical benefit. This allows you to like see your doctor or go through same day services. D, it is regulated by the government, but it's offered by a private company. So sometimes Jenna and I sit with somebody and they're like, oh, I have my drug plan through the government. They don't. They have it through a private carrier, but they may be enrolled through Medicare.gov or whatever it is. But A and B is definitely through the government. D is through a private company, just managed by the government. And then Part C has two names, Part C or Medicare Advantage. These are your private plans that if you're watching TV right now, they're being marketed a lot because this is Medicare's annual enrollment period. This is the time when people can add, drop, or change Medicare Advantage plans. And then Medicare Supplement or Medigap, again, two words to just describe the same thing. Those we'll get into in some detail as well. These are both private plans. So Medicare Advantage, Medicare Supplement are private plans. Okay, thumbs up. So far, so good. All right. Okay, head bobbing also works. All right, why does it? Oh, because they went over there. Okay. All right. So the basis of kind of everything we're doing all is going to stem from your foundation, which is Medicare. And when we say Medicare, we'll sometimes use the acronym CMS, Center for Medicare and Medicaid Services. So that's the agency that manages all of this, right? So they manage the insurance carriers, they manage brokers like ourselves, of what to say, what information we can put it out in front of you. It has to be approved by CMS. So that's the foundation we always need to build before we ever look at insurance options. So you want to think of Medicare with Alpha and Bravo. Once we have those established, then we can look at options that are a Medicare Advantage plan, that's an all-inclusive plan, or a Medicare supplement paired with a drug plan. Because we're always trying to find some way to give you guys coverage for hospital, doctors, and pharmacy. Those are the three things that we want covered for you guys in one fashion or another. All right, when can I enroll in Medicare Part A? Couple of different scenarios. Social Security and Medicare are two government agencies that work together. So Social Security, somebody can draw it at the age of 62. Medicare is not ready for most people until 65. The idea is if somebody was taking Social Security income, because Brandon is your financial advisor and says that's a good idea, means that you'll be automatically enrolled into Medicare at 65 because you're already part of the financial system of Social Security. So all of a sudden, somebody turns 65 and they're like, hey, I got a Medicare card. How did that happen? I didn't do anything. It's because they were already drawing Social Security. That's how that works. If you're not collecting Social Security, but you're self-employed or don't have a group plan somewhere else, whatever, you would need to get enrolled into Medicare, and that's a manual process. So there's where that 65 month, and then the 3 months before, 3 months after, that 7 month window is really relevant because you need to make a decision about, do I enroll into Medicare if I'm not automatically enrolled, and do I need it? So SSA.gov, for those that need to go out and enroll on their own, we kind of push you over there because it's a nice, simple way to apply for Medicare. If you are the type of person that likes to do things in person and have a full day to send at Social Security's office, you're welcome to do that too. But we're trying to help you out in case you like your freedom and flexibility. So we just have to work with the Social Security office to get you enrolled into Alpha and Bravo. If you do it the 3 months prior to your birthday month, it will start on your birthday month. If you do it in your month of your birthday or the 3 months after, it will always be the first of the next month after that. That's when Part B will start. All right, so what is A? Why do I even need A? A is what I call your prepaid plan. So every time you got a paycheck, the government just kind of came and took some money, right? Well, that was you prepaying into Medicare Part A. So that way you could utilize that when you turn 65 for healthcare. A has to do with being admitted to the hospital. So it means that if somebody just enrolled into A, do they have health insurance? Yes, for hospitalization only. So means that if they're overnighted in the hospital, they will have coverage through the government. Now, because you prepaid, there is no monthly premium that you're paying for Part A. You will pay a deductible once somebody has to use Part A for a health insurance product. This year, it's $1,632. That is the Medicare Part A deductible. And it will go for what we call a benefit period of days 1 through 60. So if somebody goes in the hospital and they're in the hospital for any time period in between, whether it's 1, 2, 3, 30, 40, 50 days, it's that one deductible for that whole benefit period. But if they leave and they come back in for something else, it is a brand new benefit period. So day one starts all over and a brand new deductible of $1,632. Okay. So that's going to be for things such as hospitalization, skilled nursing, hospice. These are all Part A benefits that the government says we will pay majority of that, but we're going to send a deductible to the member. Now, what happens after day 60? Then it becomes a per day charge. It's about $400 a day for days 61 through 90. After 90, there are 60 reserve days. It goes from 90 to 150, and it's $800 a day that the member would pay. And Medicare has a limit of 150 days. After that, then it's 100% on the member. Obviously, these are crazy numbers, but I'm just telling you the basis of what Medicare is. We would never advise you to stay there. So that is Medicare Part A. I always go too fast when I talk about this beforehand. So we just talked about this. I should have Jenna do it next time. But here's your deductible for Part A, 1632, and this does reset on January 1. So those deductibles will change year over year. But once it's in that benefit year, it's that deductible for that whole, or that deductible gets at that rate level for that entire year. So multiple hospital stays could mean multiple deductibles. And obviously we talked about there is a time limit of 150 days. If you do the math, if you're doing that in your head, it's a lot of money that potentially a member could pay if they're in the hospital a crazy long period of time. So Medicare B. So if A is hospitalization, B is kind of something you want to think of it as everything else. Same day services is a good way to think about it. It's a big umbrella. This could be your primary doctor, your specialist. It could be ER, outpatient, ambulance, flight for life. These are all Part B type of services. And Medicare is an 80-20 for Part B. Means that the government will pay 80% and you will be responsible for 20%. So for Part B, you will have a premium. So we talked about for Part A, you've earned it as you kind of went along. But Part B, when you get into the Medicare space, you will pay a monthly premium per month per person. and it's based off of your income of 2 years ago. So Social Security and Medicare, that's kind of how they relate together, is they look at your tax return and say, okay, here's where this member is, and do they fit on the first tier, second tier, third tier, fourth tier, whatever it is. But if they're at the first tier, it's the basis of 174.70 here in 2024, and it will go up here next year. And so that's your monthly cost. So if you're trying to break down your monthly, Part A doesn't have a premium. Part B is 174.70. If you used Part A, then it's that deductible of 1632 we talked about. And with Part B, if you go to a doctor, you're going to pay that deductible of 240, which is a one-time for the entire year. After that, Medicare is an 80-20. Medicare says we'll pay 80% of any of these Part B services that we just talked about. Ambulance, doctor, PT, those kind of things. And 20% is what the member will pay with no limit. So people could keep paying that 20%, 20%, 20% over and over. And Part B is where people say, oh, there's this penalty. That's where people get penalized, is on the Part B side. So you as a member, when we sit down and kind of help you out, it's saying, hey, is Medicare the right way for me to go, or should I do something else? We're going to say, well, what is your other option? Are you on the individual market? If that's the case, you need to go on Medicare. Do you have a small business insurance? You need to go on Medicare. Are you working for a large employer that is, more than 20 people? Are you working full time? These kind of situations, we may suggest you to stay on your employer plan. We have to do the due diligence before we ever say that's a black and white scenario. Okay, so we talked about A for hospitalization, B for doctor's benefits. You also need D for Delta, which is your prescription drugs coverage. And this can be done in a couple of ways. We'll get to that here in a second. But what Part D is to help you with your pharmaceutical. I take blood pressure or cholesterol or a sleeping medication, whatever it may be, they're going to come from the Part D side. So we would need to establish a Part D coverage for you, so that way, if you prefer to go to, Walgreens or King Soopers and you take whatever medication, we will help you find a plan that will allow you to be able to get those medications, and we'll try to find an option that gets them to you at the most cost-effective approach. You need to be enrolled into Medicare A or B in order to be able to enroll into a Part D plan. Why did I put this in here already? Okay. So Part D is probably where we get the most questions on how it operates. As we mentioned in the beginning, Medicare Part D is provided by a private company. So you'll have a Part D plan, and maybe many of you already have a Part D plan. You could tell me, hey, I have it through United Healthcare, Shane, or I have it through Humana, or I have it through Cigna. Those are the private carriers that you're running your prescription drug plan through. But those carriers are going to the government and saying, can I offer a Part D plan? And what are my rules? And so they're abiding by the rules that the government sets. Okay. So the stages of Medicare Part D are as such. They will initially have a deductible on a lot of the plans. They'll say, you need to meet X before the carrier will get involved helping you financially. So the most they can put as a deductible is $590 on a plan starting January 1. Some plans may have a lower deductible. Some may have an exclusion on generics, but the most they can ever put is $590 on a Medicare D drug plan. So meaning that they can't have like a $1,000 Part D deductible, for example. So the member would first, pay that deductible, then they get into what's called the initial coverage. And this is where, depending on the plan that you have, it may have a fixed structure of, if I pick up this specific medication, my cost is fixed at $25, $45, something like that. That is a fixed copay. It may also have a percentage. where it says, hey, you need to pay a percentage of whatever it costs the plan to offer this. So if I do simple math and say that medication costs the carrier $100 and that percentage is 25%, means the member would pay $25 for that medication, right? If that cost of that medication went up throughout the year, so will the cost to the member because that 25% is going to stay proportional. Now, in 2025, which is new for any year before, there actually is a cap on Part D spend. In 2025, the most a member is going to spend on prescription drug coverage, meaning cash out of their pocket, is $2,000. Medicare has never had that before. That's why there's always been this term of donut hole, coverage gap. Well, people would pay their fixed dollars and all of a sudden they'd fall into this donut hole where their costs started going up. And they're like, I can't afford my medication because it used to be fixed. Now it just skyrocketed. That was what the donut hole was all about. Well, starting January, there's no more donut hole, no more coverage gap. So it means that they'll go from the initial coverage to that $2,000, and then they won't spend another dime if they get there for the rest of the year. And that is going to be on every single Medicare Part D plan. Doesn't matter about the specific carrier, and it doesn't matter whether it's a standalone plan or it's embedded into a Medicare Advantage plan. So the way that this is structured will really help some of those people that are on not really a lot of medication, but expensive medication. Because you could still be on 10 medication, they could all be generics. But you could be on one medication that can cost $1,000. So just depends on the cost of the medication to the plan. So we talked about A, we talked about B, we talked about D. What is Medicare Advantage? Medicare Advantage is a type of insurance product where it bundles A, B, and D all together in one plan. This is most similar to a group plan. So if you're on a group plan today, or if you're transitioning into Medicare and say, I want something similar to my company insurance, you're really talking about a Medicare Advantage plan, where you would have one carrier that manages your hospital, your doctors, and your medication. Now, there could be multiple Medicare Advantage plans in your market. It's always going to depend on the zip code and county of where you live. I'm just going to take an assumption that you're in the Denver metro somewhere, right? But if you're joining us from Grand Junction, your plan options are going to be different because it's based off of the county that you reside in. Okay. So we will always ask, what zip code and county do you live in before we present an option, because we need to know a Medicare Advantage is available. And depending on the insurance carrier, they have a choice whether they want to offer a plan in that market. And if they do they offer a Medicare Advantage, HMO? Do they offer a PPO? It could be a lot of different options. So if you're talking to friends or family that are living in California or Florida, and they say they're on a great Medicare Advantage, that's awesome for them, but it's because of where they are. We need to look at it based on where you live and what options you have available in that benefit year that we're looking for. So again, it's offered by a private company, combines A, B, and D. Many plans have a zero premium. So it means that you're paying into Medicare, but you may not pay anything in addition to be a part of the Medicare Advantage plan in our market here of Denver Metro. And premiums and benefits will definitely change year over year, and it will definitely change from carrier to carrier. All right, quick water break. Jenna got one, I get one. All right, eligibility for a Medicare Advantage program. So to be eligible for a Medicare Advantage, you need to be enrolled into Medicare A and B. So whether you're in Medicare Part A, premium free, or you pay for it, that's up to you. We'll walk you through that. Medicare B, you need to be enrolled into Medicare B in order to qualify. So the reason we say that is that there's some people that may have A only and not B. They wouldn't be eligible. Maybe they just chose not to take Part B because they didn't want to pay. I don't know what the situation is, but as a minimum requirement, you need to have A, B, live in one of the service areas where one of these Medicare Advantage carriers offer a product. And you need to have a valid, what we call an enrollment period in order to enroll in the plan. Right now, we're sitting in Medicare's annual enrollment period. This is why it's such a busy time is people will say, well, I had this one plan last year. I don't know that it met my needs. Jenna, can you help me find a new plan that covers, this doctor that I can't get access to? Or I heard some advertisement about this food benefit. How do I get access to that? Or I need some dental coverage because I didn't have any this year. How do I get access to that? What carrier offers that type of benefit? There's a lot of needs analysis that we'll do in order to taper it down to kind of what you're looking for. There are also special needs plans out there. Sometimes they're based off of income, so Medicare, Medicaid. Sometimes they're based off of health conditions. So if somebody's got congestive heart failure, they can qualify for a chronic health plan. So there are different types of Medicare Advantage plans out there. So as we talked about, this is Medicare supplements now. So Medicare Advantage, A, B, live in the service area. You'll be eligible for that. Medicare supplements, these are the other option. You can only have Medicare Advantage or a supplement. I was asked by somebody the other day, can I enroll in a Medicare Advantage? And then can I enroll in a supplement to pay for those copays? The answer is no. You've got to pick one or the other. So we showed you a slide earlier, we'll get back to it, which is you got to pick an Advantage or a supplement with a Part D. One of those two. So to be eligible for a supplement, you have to be enrolled into Part A and B. And supplements are statewide. Instead of just the county, it's state. So somebody that's living in Denver County or somebody who's living in Durango, if they're eligible for a supplement, they're eligible for the exact same coverage. Now, for a Medicare supplement, you're going to have an open enrollment or a guaranteed issue period where Jenna and I will not ask you any health questions because you're going to be issued a plan standard. If you miss that open enrollment or guaranteed issue period, they can underwrite you. What that means is they can ask you health questions and approve you or deny you into a Medicare supplement. Sometimes people don't know that, so it's really important for us to have that conversation of timing and product. So the timeline for open enrollment for a Medicare supplement all has to do with when you applied for Medicare B as in Bravo. So if we use that example we did earlier, which was I'm turning 65, I enrolled into Medicare, well, your open enrollment is going to be your birth month and then 5 months after. So you got that whole 6-month window there to say, I can apply for a supplement with Shane or Jenna through Integrity Health Advisors. They're going to help me, and I'm not going to have to ask any, I'm not going to have to answer any health questions because they're going to tell me that I'm going to be issued standard, even if I'm going through medical treatment because I'm in my open enrollment. Okay. If you're missed that 6-month window now and you're not in a guaranteed issue period, we're going to ask you health questions. What medications are you on? Were you hospitalized? Are you trying to get the supplement to cover a surgery that you've been putting off? A lot of these other things could deny you for a eligibility to get approved standard, or you may get rated. Or, hey, guess what? Maybe you just applied and all of your answers are no, you're going to get issued standard. So we'll help you with that. One thing that kind of trips people up, and I'm not sure why the government did this, but they give you 2 names for the same product. So a Medicare supplement and a Medigap plan. They're the exact same thing. What they are is a secondary product, again, private, to Medicare. So the government is primary for hospital and doctors. And then you would have a private secondary plan that says, I want you to pay that Part A deductible that Shane was talking about, that $1,162. I want a supplement that pays that 20% because that sounds kind of scary. I don't know what 20% of whatever could be. What if it's 20% of a flight for life, which is a $50,000 estimated cost? I don't want to pay 20% of that. A Medicare supplement can come in and pay that. Medicare supplements are offered by a private company. There's a lot of different companies that offer that here in Colorado. I want to say you're looking at 30, 40 different carriers that can offer a supplement. Obviously, there's different reasons you would choose one carrier versus another. Sometimes it's rate, like what does this carrier charge versus that carrier? It could be that name recognition. You could tell me that, let's say Eve is on the call and she's like, I've been insured by Anthem through my company. I want Anthem when I get into Medicare. Sure, that could be a valid reason as long as everything lines up with, the premium and they offer the plan that you want. We'll help you with that. We're contracted with a lot of different carriers. One thing to take away is these are all standardized plans in the state that you have a permanent residence. So if you look at a plan G or a plan D or a plan A, whatever, it's the same across every single carrier. So what I mean by that is if somebody says, Shane, I want a plan G with United because it's a better plan than plan G with Anthem. No, it's not. It's the exact same thing because the coverage is standardized for every single carrier. So then why would I pick one versus another? Again, it could be that you just have favor to one carrier because you recognize their name. They're going to be easier to use. Maybe that carrier doesn't say you have to do any claim paperwork. Well, that's easier on you. It could be that the carrier provides some sort of value add in addition. Do they provide a vision discount or a gym membership? We can help you with that. But again, based off the medical A, B, C, D coverage, they're all going to be standardized across the board because the state says so. Now, again, we're talking about Colorado. If you say, hey, there's a plan G in Colorado and there's a plan G in Minnesota, are they the same? No, they're not because they're state by state. Okay. Anything else we want to add there? Okay. So I don't know how it's clear on your screen, but again, this is just a simple visual that I put out there because Medicare supplements are just that. They're a supplement to Medicare. So A dictates what your coverage is for A and B type of services. And then depending on the level of coverage that you pick, whether it's A, B, C, whatever it is, it just comes in and says, hey, we're responsible to cover this. So I'll use G for an example, because that's the top of the line plan these days in 2024, 2025. It means that the member will pay the Part B deductible. That's $240 in 2024. After that, you can see a check mark right there on that grid. Means that the plan G will pay for every single one of those services. So after that $240 deductible, the member goes in for a doctor visit, an MRI, physical therapy, ambulance, whatever. What's it going to cost them? Nothing, because the plan G will come in and pay. Well, what is the premium of plan G? I don't know. It depends on each individual person here. We can run a quote. So depending on where you live in the state, your gender, your age, your tobacco status will dictate some sort of premium level. But if I use a general number just to give you an idea, Denver Metro, female, non-tobacco, turning 65, 160. 160 is probably a fair estimate. Again, it can vary. We can find somebody a little bit cheaper. We can find somebody more expensive, but that's probably a good fair budget estimate for you to take away. Medicare supplements. They are definitely a backup to Medicare. So you want to know that Medicare itself pays for the service. So if you go to see a doctor and say, what if I'm a Medicare patient? I just don't like the way my nose looks. And I go and say, hey, I would like you to readjust this thing because of vanity at 65. And they're like, okay, great, we could do that. It's cosmetic. It won't be covered by Medicare. Well, but I got a supplement. Will that pay for it? The answer is no, because Medicare has to deem that as medically necessary and pay their 80% for that supplement to come in and pay the 20%. Has to be a first and a second position. Now, Medicare is the same across the entire country. So whether you have friends that are in Portland, Oregon that are using A and B, and you're using A and B here in Denver, you have the exact same coverage. So if you're traveling and you go somewhere else and you see a doctor that takes you as a Medicare patient, your supplement from Colorado is going to follow you and just pay the difference. So it's very flexible and transferable for those people that want to use it to move around. Maybe you guys got a fifth wheel, you're camping around everywhere, trying to leave the snow and go to Arizona. A Medicare and a supplement will give you that kind of coverage. As long as you get issued the plan, when you have open enrollment, guaranteed issue, or maybe you just pass the health questions, as long as you pay your premiums, that plan will renew every single year. The reason we bring this up is some people ask us, well, I had some health conditions this year. Am I going to be dropped from my plan for having a health issue? The answer is no. The plan will never rate you for utilizing your healthcare plan. Maybe somebody went through cancer this year. Are they going to rate them for that? The answer is no. They're going to increase the rate for everybody that's in that plan, not just individual by individual. As long as you pay the premium and as long as that carrier is still in business, it will keep renewing for life. All right. So bringing it back, we've talked about a lot of different things. I know that, and some of you are taking some diligent notes. That's awesome. Please know that we're here to help you decipher those notes. I know I've written notes, and I don't know what I wrote down, so we'll be able to help you. But bringing it back together is that Medicare A and B has to be established for us to help you with a private plan of some sort, whether that be a Medicare supplement with a Part D plan, or is it a Medicare Advantage plan? One of those two should be your question. Which way am I going? And that can be unique even for a household. So one spouse could say, I really like a Medicare supplement with a Part D for me. That makes sense. Great. The other spouse could say, I really like an Advantage plan and I want to do that. You guys can do that. Medicare sees you as a household, but you can pick individual products. Unlike when you were insured by a group plan, you had to be on the same one. Okay. Whew. All right. I talked about 47 minutes nonstop without a breath. So you guys did grab hopefully some, like we said, golden nuggets out of what Medicare is. But please know that we're here to assist you. We're not here to sell you something. Otherwise, Brandon's going to fire us as a partner in the market. We're here to help you and guide you, answer questions. You could be in Medicare and just say, hey, can you just review my plan? I want to make sure that the plan I've been in for the last 2 to 3 years is good for me still. Let's go ahead and do that. So I'll tell you a funny story. Not funny. I had some clients that have been with me since 2009. They came in this year and they're like, were we supposed to talk to you every year? I was like, have you not received any of my emails or postcards or anything? They're like, oh, we have. We just kind of, put our head in the sand and said it's working, so we didn't do anything. I was like, it's okay to just give me a call and just say, hey, here, how's life? So I remember who you are in 15 years because I didn't remember and I felt really bad. But they had gone through some serious health issues. And I think if they brought it up, we could have changed their plan to help accommodate for that specific year from a out-of-pocket perspective. The other thing is that whether you're in a Medicare Advantage plan or a Part D plan, things change. And so you need to know how those are going to impact you for the next year. I know Brandon's, brought us on, and you guys have had the privilege of knowing Part D changes for next year. Not everybody knows that there's a $2,000 cap. Not everybody knows that there's a donut hole going away. And I think it's really imperative for those members to know that. So when they utilize the benefit in January, they're not shocked by something, or they're ready, on how to use their healthcare. Are we in the most sexy of industries? No, probably not. It's Medicare, but it's really, really important, right? It's not really important for us. It's important for you because you're the one utilizing your plan. And we just want to be your ally out there, or your guide, or your advisor, so you can say, hey, I got somebody I can call, and I'm not calling 1-800-Medicare. Otherwise, you're going to get stock answers. They're going to say, hey, yeah, it's covered if it's medically necessary. Well, can you give me a little more guidance? No, they can't. And unfortunately, we've run into it where they've given bad advice, and they're supposed to be the source of truth. So, we'll call your doctors for you. We'll do a lot of different things to make your life a little easier, and so you're not burdened with some of these things. So anyways, I really do want to say thank you to Brandon having us on here, for you guys joining, because I think it's really, really important for you guys to gather knowledge. So what, even if you don't need our services, but you took away for some information that helped you, that's perfect. That's really what we're here to do for you guys.
Shane, we did have one question come in. Do you have a second for Q&A?
Yes, sir. Yep.
Okay. So the question that came in was from Beth and Dave. They said, what if I have group health coverage as a retiree? And what if my spouse has group health coverage through me and I'm a retiree? How does that impact enrollment?
That's a really good question. So that's a kind of a personal situation where we would need to dive in to see. Again, we talked about, do they have A and B? Some retirees don't, some do. That kind of would come into, do you have a penalty for joining Medicare, or are you getting a stipend through your company to join their retiree plan? How does the cost and benefit compare to a Medicare option? So there's a due diligence of needs analysis that needs to be done, versus a black and white of saying you should never be on a group retiree plan. There's many that are amazing that I would say, please don't ever drop that, because if you do, you may not be able to get back in. We work with a lot of different members from different sorts, but this year, para members, somebody who was a teacher, had, para coverage, their benefits went backwards. Or actually, I shouldn't say that. The benefits are amazing. Their cost has skyrocketed. So that group retiree should really do evaluate the private market this year. Not in the last 3 years, but this year for sure, because their cost is tripling, I think. Yeah.
Hey, Shane, one point of clarity on the slide that you have up here, your phone number, the last digits, it's 43373. It looks like there's one too many numbers in that.
4337.
4337. Okay.
I added an extra 3 at the end because she's triple good.
Perfect. Yeah, just wanted, we had somebody point that out. They were going to give you a buzz.
Okay.
Okay, 4337. Got it. Any other questions for the group before we move on with the day? You can unmute yourself and ask out loud, or you can put it in the chat box.
Oh, so there's another question here about the group retiree that's federal.
Yep.
So let's look at that here. If you're a federal retiree in a group health plan and don't have A or B, is there a reason not to sign up for A if you qualify to receive it for free? A great question. If you qualify for premium free Part A, as long as you're not in a health savings account, go get premium free Part A. It's great to have. It's a backup to your company plan. It's awesome. Or if you're a federal retiree, it's actually primary. If all you have is just A. B is a different situation, of course. But if you're qualified for a premium free Part A, I would say take it, as long as you're not in a health savings account.
Hey Shane, this is Pat Alfano, another advisor here at Prosperion. Thanks for your time.
Yes, sir.
We had a client that turned 65 last year. This year ended up having to move states after having re-upped on their state plan. And then she was saying that she would have to pay a full another well, I forget exactly how the phrasing was, but it was going to be very expensive to switch to the new state plan mid-year. How do you guys navigate that as far as benefits go?
So are you talking about somebody that's not on Medicare?
No, they are. They enrolled in Medicare in 2023, moved this year in 2024 after re-enrolling in the state. I guess you're right. It would be the Medicare. It was a Medigap policy.
Okay.
More expensive when they move from Colorado to another state.
Yeah, so I'm trying to understand what the member was asking you, which you're not a Medicare expert and you're trying to explain it to me. So I'm making some assumptions. So as Jenna was kind of thinking too, is if somebody's in a Medicare supplement here in Colorado and they move mid-year to another state, their premium was going to change because they're in a new state, could go up or down. They wouldn't have a new Medicare Part B deductible to meet because that's national. So that's a point of question for me. But if they're in a Medicare Advantage plan, let's say in Colorado, and they're here 6 months and then they move somewhere else and they have to re-enroll, they absolutely start over. So if they're in Colorado and let's say they met their max out of pocket and they moved mid-year to somewhere else, are they going to start all over? The answer is yes.
Okay. That was the question. I appreciate clarifying that. I'm sorry my terminology was all messed up.
That's all right.
Yeah, that so they do. There's no ifs, ands, or buts around it. There's no way to protect against that except for tell the client not to move until the next year.
Well, I'm not sure if I'd advise that either because there's probably other reasons, but that's a one scenario where we could look at like a supplement for the next 6 months because then they wouldn't have copays and stuff because they'd have a secondary picking that up. Obviously, if they met their max out of pocket in 6 months, there's stuff going on. There's things that we could probably do.
Great. Thank you for your help.
Yes, sir.
All right. Any more questions for Shane and Jenna?
I think the chat box is empty, so we did good.
I have one question, just so I understand. This is Tammy Kirks. My husband Alan and I are on. We actually live in Florida, and so, but I appreciate your time. And I think every time we listen, we understand a little more. And I've been reading up quite a bit. But I just want to make sure what the final cost for monthly premium would be. So you would have the monthly premium for the Part B, Medicare Part B, which for 2025 is going to be $185. And then whatever Medigap, if you did the supplement, the Medigap plan, and you used a number like 160. So you have 185 plus 160 plus then whatever the drug premium would be. And that would be your total premium then that you pay every month. Is that correct?
That is correct.
Okay.
Yep. That
right.
as a basis goes. So yes.
Okay. I just wanted to make sure when I'm adding up numbers, kind of what I'm looking at. So then as far as adding a vision and dental plan, can you add those on like you do the drug plan, even if you do a supplement plan, or do you have to have a Medicare Advantage plan in order to get the dental and vision?
So good question. So if you're in a Medicare Advantage plan and we pick a product that has it included, it's all going to be bundled, right? But if somebody says, I really want a supplement and a Part D, but I want dental and vision, we can put that together for you a la carte. So just kind of piecemealing all of your benefits together.
Okay. And then just one last question to kind of piggyback on Pat's, because right now we're in Florida, but during 2025, we may be moving back to Arkansas. So probably the best thing for us to do at this point in time would just be go on and do a supplement plan. And then once we get moved and settled, then maybe look at the Advantage plan. Am I understanding that correctly?
Depends. I wouldn't say that as a given because
Okay,
that move is going to generate a new enrollment period for you. So, for example, if you're in Florida and you're in a Medicare Advantage plan and you move to Arkansas in 7 months, you would call us and say, "Hey, this is where I'm going. What type of plans are available there?" And let's say there's not a great Medicare Advantage plan. That's an opportune time where you would be guaranteed issue into a supplement. Or vice versa. You're in a supplement in Florida and you get to Arkansas, there's an amazing Medicare Advantage that you want. We can move you into a Medicare Advantage plan.
okay. And then you said something about asking questions. So we're currently on a group plan with our employer and are trying to get a surgery scheduled by the end of the year, but that may not happen. And
Okay.
so we may have to have that surgery in 2025 so what would that look like? Would they, like, how does that work then? Do we have to go through a prior approval time? Would they not give us the insurance if they know this surgery is pending or?
Okay, so there's multiple questions. So let me ask the first one or answer the first one, which is on you would be depending on the product that you enroll in, right? So let's say you went into the supplement because you mentioned that a little bit ago. You would be guaranteed issue because you're coming off of a group plan. So there would be no pre-existing condition type of stuff. And then if you went into a supplement, then it would be simpler transition to get that surgery covered. If you went into an Advantage plan, you would need prior authorization by that carrier. So that could delay something. But you would still be eligible for the procedure.
And then our supplement plans, basically PPOs, Medigap plans.
It's the word that we use just to give you some definition of understanding, but Medicare supplements are actually not PPOs. They're unique in themselves, as that Medicare is the same across the country, and there's
Okay.
really no in or out of network. It's Medicare or not.
Okay.
So it's basically Medicare's network, which is a little bit stronger than a PPO. I would say that's the largest network we can provide you is Medicare.
Okay. But when you go to an Advantage plan, you have to be careful because they're PPOs and HMO plans, correct?
That is correct. Yep. And everyone's a little different. So like Colorado doesn't have them, but Florida has regional PPOs,
Yeah.
which means you can only use it in certain counties. Or there's national PPOs, which you could use across the country, or HMOs, which means you can't really leave like your geographic region of wherever your primary doctor sits.
Okay. All right. Thank you very much. That answered a lot of questions for us. I appreciate it.
Yeah, you bet. Thanks for joining.
All right, well, Shane and Jenna, I think we'll wrap it up here. If you guys have more questions, please feel free to reach out to Jane and Jenna, or Jenna and Shane, excuse me. I know they'll be eager to help you sort it out. So thank you guys so much for your time today, Jane and or Shane and Jenna. I don't know why I keep saying this backwards. You guys, thank you for your time. And we'll be in touch with you guys. All right, look
All right.
forward to talking to everybody.
Sounds good.
Thank
Thank you.
you.
Thank you.